All right. Well, so here's the next controversy then, what about pre-procedure imaging? Do you ever do this without any pre-procedure imaging? I usually get something if I haven't looked at the prostate, but I guess you should make the distinction between pre-procedure vascular imaging or any imaging of the prostate. Kind of interested how you feel about both.
Yeah. So I think the big thing here is, and I know, things are different elsewhere in the country. It really depends location to location, but imaging is not typically part of BPH workup. It's not considered standard of care.
Okay.
And so if a patient goes and sees a urologist, he's not getting an MR, he's not getting a CT scan to tell his prostate is big unless he has some other indication, cancer, hematuria, something like that. So it's not part of the typical workup. So if they come to see you and you want to get a CT scan or an MRI or whatever, it can be difficult to get that covered by insurance.
Yeah.
And then your patient is left with an out-of-pocket cost. And truthfully, all these minimally invasive surgical therapies are all being done, for the most part in the community without necessarily getting all this high-level cross-sectional imaging that we would require for IR. Now, that being said, lots of groups have shown, regardless of prostate size, you can treat these patients as long as they have the right inclusion criteria in terms of symptoms. And so I would argue that with enough experience and the right equipment, you shouldn't need cross-sectional imaging to be able to take a patient to angio and treat them, especially since it's not part of the regular workup and you could be leaving the patient with a cost that they'd have to cover themselves.
Yeah, I'm with you. I agree, and I most of the time it doesn't add much. And I hate to be, too anecdotal on here, but like two of my last patients that had been referred, I got imaging on them. And the first one had the tiniest prostate that I think I've ever had referred. It was so small. It's I just don't think I'm going to be able to really add much for you. And the other guy had a bladder full of stones. But again, that's very rare.